Will the Committee of Supply please come to order? This section of the Committee of Supply will now consider the estimates of Executive Council. Does the Honourable First Minister have an opening statement?
Yes, Mr. Chair. And first of all, I thank members of the committee and you, Mr. Chair, for allowing us to meet in this format. I know our House leaders worked hard to devise a manner in which we could meet effectively to protect the safety and well-being of all members. I know it's an innovative approach by the nature of the challenges we're facing together. And so I just want to say thanks to all the members for accommodating that. I also wanted to preface my introductory comments by saying that I will, as I have in the past, undertake, if I don't have the information members are asking, that I will undertake to get it to them. And I hope they'd agree that in every past year that has been my undertaking, and I have provided in every respect any information members have asked of me, of my government, and I'll continue to do so. I am pleased on behalf of the Executive Council, Mr. Chair, to present the financial estimates for the 2020-21 fiscal year. And in doing so, I am committing to Manitobans that through our budget, we'll continue to deliver on our promises as we have. Of course, this is, to put it very mildly, an unprecedented year in Manitoba history. We will continue to battle COVID-19, and I will certainly be pleased to answer any questions members may have in respect of the measures that we are taking in response to the pandemic and will continue to take. Protecting the health and safety of Manitobans remains our top priority, and we are focused squarely on our response to COVID. And it bears repeating that Manitobans are also still being strongly encouraged. And I thank members of the opposition for repeating these, including the leader of the opposition, for repeating these messages about good hygiene, social distancing, cleaning your hands regularly. You know that sometimes, as we've said these things so many times, dozens and dozens of times through the more than, with my health minister and myself, more than 110 times, I am told, we've gone out to the public. I believe, frankly, at each of those opportunities, we've repeated these messages. I know that other members have done the same, but it bears repeating that we are still very, very much in a battle with COVID. It's a sneaky, nefarious thing. And the way that we can beat it is through good personal hygiene, social distancing, cleaning hands, the issues around staying home, away from others, especially if you're sick, maintaining that distance, that 2-meter distance from others when in public. And these are important messages for us all to remember and to repeat, and all of us are doing our best to do that. And we spent more than half a year now living with this pandemic. I think in many respects it seems much longer to probably all Manitobans, but it is an ongoing challenge. And so I know that these messages and others are common messages, but they bear repeating. This virus is unrelenting, and our response is unrelenting as well. To date, we've allocated more than $1.2 billion specifically to COVID-related spending. And given the opportunity, Mr. Chair, I will go through those COVID highlights, but if the members are interested in more data and detail on these issues, I'm happy to share it. But I just will say, to keep my comments, I hope, charitably brief. I look forward to any questions members may have. Look forward to answering them directly if I can. Where I can't, as I've said, I will undertake to get the information they're asking for as we move forward together. And I would encourage, in the spirit of teamwork, members to take that approach as we are dealing with an unprecedented situation. We are reminded, however, that there are precedents in respect of other challenging situations that our province and country have faced before. And when those situations have arisen, very, very often, it has been a willingness on the part of all political representatives to pull together in a common direction that has assisted us in making better results happen. I would give as an example of that the opposition's support, official opposition's support, I should be specific here, in respect of the resolution on healthcare that was presented, and not to read it into the record, Mr. Chair, but suffice to say, we joined together to call on the federal government to resume its rightful responsibilities in sharing in the funding obligations on healthcare. And that is important, as those obligations haven't been met in recent years in particular. The need for healthcare services continues to grow and was growing significantly because of many factors. Largely the baby boom, of course, has contributed to this as our population ages. Demand has risen, and this all before COVID. So right now, Mr. Chair, we have the highest growth rate in demand for healthcare ever in Canada's history, and the lowest percentage of federal government support for healthcare in the history of Canada since the Canada Health Act was passed. It is disappointing, of course, that we couldn't have had unanimous participatory support from 3 legislators. But that being said, those who voted did vote unanimously. And I will share with opposition members and my colleagues that other provincial governments are planning to proceed with such a resolution in their jurisdictions as well, so that we can add their voices to Manitoba's voice. And Manitoba has been leading this challenge, a challenge that needs to be met. There are great needs in our province, never more than now, for healthcare services to be available. Funding cannot, in perpetuity, be borrowed by provincial governments for this purpose. It is not sustainable. Every single expert agrees with this. And so to have our opposition New Democratic Party members join with us in support of that resolution, I just wanted to say thank you to them for that. It is a very important message, and it's one that I'm speaking again to Premier Horgan later this week, but it's one he has also been taking forward as a New Democratic Premier in British Columbia, and others of other parties, Liberal premiers as well. In the Yukon, Sandy Silver, who was active with Premier Horgan and I in promoting and advancing the idea of paid sick leave very early on. We were able effectively, 3 different parties, but the same priorities, able to achieve some actual outcomes as a consequence of that from the federal government, and we thank them for that too. So there's much more for us to fight for. I'm sure there'll always be reasons for us to find things to fight about, but I would urge members to continue in that spirit of solidarity and cooperation that was so evident last week. And I'll leave my intro comments at that, Mr. Chair, and thank you for the opportunity.
We thank the Honourable First Minister for those comments. Does the Leader of the Official Opposition have an opening comment?
I do.
The Leader of the Official Opposition.
Well, thank you very kindly, Mr. Chair, and also I want to thank the First Minister in advance for his participation in the committee, and of course to all the staff, both from the Legislative Assembly and from our respective political operations who are making this possible. I just want to begin by acknowledging what's happening in the room here for those who are attending virtually or just viewing this online, because this is a committee hearing like no other, and it is, I think, a testament to how different 2020 is from any other year. You know, I'm sitting here in the committee room and I'm joined by the chair and some Legislative Assembly staff, but I can tell you that all the staff in the room are wearing masks, and so I will endeavor to keep my mask on while we're all in this space here together, just out of respect for their well-being and just to do my part to hopefully you know, help everyone's health. At the same time, of course, the fact that the Premier is logging in virtually is also another point, I think, that just shows us how different this year is. And many of our colleagues are joining virtually as well. For the first time in our 150-year history, we're having a committee structured in this way. And while maybe there's an argument to be made about you know, getting with the times and allowing for technology to be used in our parliamentary work this way, I don't think any of us wanted it to happen like this, with such a social and health cost going on outside the legislature. So yeah, this is truly a committee unlike any that we've seen before in Manitoba, but I expect that the principles of democracy and accountability and working for the benefit of Manitobans will continue. When it comes to the budget that we're considering here in the estimates process, you know, this is an important opportunity for us to ask questions of the government, to hold the government accountable, and to be able to get more information that can help Manitobans understand what is happening in our province today. And so we take that as the opposition very seriously, and we look forward to being able to dive into as much estimates as this week will allow, though we don't have a ton of time because there is a deadline looming. I do think it's important to point out, however, that the budget that we are being asked to consider by this government is one that was prepared before the pandemic arrived in Manitoba. And so it does not really adequately contemplate the true impacts of COVID-19 and the recession that it caused on our province. We see that both in terms of the projections for revenue, but also in the program of spending. And I'd say that the most obvious example of that, the most glaring example, is the fact that this budget cuts public health spending, which currently, like, we can all see that that was a mistake, and hopefully has been rectified since the documents were prepared. But just as one example of how, you know, the government could have taken the 8 months that they've had and gone back to prepare a new budget and to bring forward new documents that would give us a more accurate snapshot of what's happening with the province's finances, but also with the program of spending. And certainly there is a lot of policy questions that we want to seek some answers to. You know, I have been talking over the past number of days about some calls that we've been making throughout the pandemic, but have really become all the more urgent with the dramatic increase of case counts over the past number of hours. And that is specifically that we need to increase intensive care unit bed capacity system-wide and see more investments in healthcare at the bedside. And also that the small businesses in Manitoba do need more supports. There needs to be new interventions to help these businesses keep their doors open. And we know that the current programs on offer, whether it's from the province or from the federal government, are not up to the task. I was speaking with one business owner yesterday who made the point, and he's repeated this publicly, that I thought was quite effectively. He says a wage subsidy doesn't help me if I have to close my doors and my employees aren't there. His point, of course, being that he still faces fixed costs as a business owner, and none of the programs announced to date really will help him deal with the scale of the fixed costs that he faces month in and month out. So that's just a little bit of, I guess, a look ahead at some of the lines of inquiry that we want to explore here in the estimates process. I want to acknowledge that the Premier did bring forward that resolution on the healthcare transfer last week, and we were pleased to support that. Of course, who wouldn't want more funding for healthcare in Manitoba, especially during a pandemic? I know that my colleague who is chairing this meeting, for instance, is in his own backyard. They've seen staffing shortages and issues with diagnostic services in Shoal Lake, and I'm sure each of us in our respective constituencies could catalog where we would like to see more healthcare investments made. And so, of course, who wouldn't want to see that healthcare spending happen? However, I would point out that the Premier and his party voted against our amendment that would have actually guaranteed that every single dollar in federal health spending would actually make it to the bedside. And so we are very concerned that perhaps this is just a PR campaign designed to get more money sent to Manitoba, but that it won't actually be used for the expressed purpose for which it was demanded. And that is a big concern, because we know that healthcare was already behind the 8 ball before the pandemic started. And if we look at all the public letters and advocacy that physicians and nurses and healthcare folks have made over the past number of days, I think we can all conclude that there is still an even greater urgency behind the need for us to adequately fund healthcare in Manitoba. Now, this is a crisis, and this is an important time for Manitobans. You know, I'm joining you here today from a room in which there's oil paintings of leaders of the province past, and certainly I would be surprised if any of them had to contend with a crisis greater than the one that we're currently confronting. Perhaps they had to confront crises which were the equal of this COVID-19 pandemic, but I don't think that they had to contend with something that is as far-reaching or more far-reaching and more impactful than the current one. So I do want to acknowledge that we carry out our work here in as much as there will be, challenging lines of inquiries and, exchanges back and forth, that we do carry out this work against the backdrop in which Manitobans so desperately need our government to be able to function and to be able to function at its top capacity. And so, you know, we're here as the loyal opposition to do our part and to ensure that accountability, information sharing, and people's understanding of government does get increased and is not, in fact, locked down due to COVID-19. So with those few comments, I'll turn things back over to you, Mr. Chair, and thank you in the process.
We thank the Leader of the Official Opposition for those remarks. Under Manitoba practice, debate on the minister's salary is traditionally the last item considered for a department in the Committee of Supply. Accordingly, we shall defer consideration of line item 2.1 brackets A and proceed with consideration of the remaining items referenced in Resolution 2.1. Given that the estimates of Executive Council consist of only one resolution, the discussion will proceed in a global manner. I would ask the Honourable First Minister to please raise his hand when he would like to speak, so I have the ability then to recognize him and know he's ready to speak. The floor is now open for questions. The Leader of the Official Opposition.
Thank you, Mr. Chair. I wanted to pick up on some of the discussion that the First Minister and I were having during a question period. And in particular, one question or one comment that the Premier made, I would like him to clarify on. So I asked about increasing testing capacity and contact tracing capacity in the summertime, and the Premier made the comment that would we have invested in contact tracing capacity and testing capacity in the summertime, that would have been idiocy. And that word idiocy is a direct quote from the First Minister. So I wanted the Premier to expand on that and to explain, is it actually the case that he believes that preparing in advance for a second wave that we all knew was coming was idiocy, that investing in contact tracing and testing capacity in the summertime, while we had some breathing room to be able to do so, was idiocy? Or was this simply him misspeaking and perhaps he would like to correct himself?
The Honourable First Minister.
Thanks. No, what the member advocated today and earlier against the recommendations of the public health officials was for asymptomatic testing. He came out on record contradicting directly the health experts of our province. He has done this on other occasions as well. And this is what I refer to as idiocy. Frankly, these people are trained professionals who lead our healthcare battle. As far as the member is concerned, based on his advice to Manitobans, they should have earlier in the year, and they should now, if they have no symptoms, go and get tested. This is what I refer to as idiocy, Mr. Chair, not the issue of preparing. Most certainly, our health officials have been preparing in earnest for some time. The plans that they're enacting now are as a direct result of that preparatory work that they've done. Just to illustrate, we now have 30 sites in total across the province of Manitoba that have or will be opened in the next while. The capacity to do daily tests has gone up by well more than 1,000 per day, average weekly test results as a consequence of the incredible intense efforts of our senior health officials. When the member contradicts the advice of our senior health experts for whatever reason he may choose to do so, he calls their advice into question or attempts to. He is not a medical expert, nor am I. And I think that is the idiocy, Mr. Chair, that we have to always be careful of here. As our senior health officials are qualified people, we are trusting to make recommendations that we are following, and they're planning, and their intense efforts to plan are what are resulting in the opportunities to meet the demand that we now have. Our wait times have reduced. For Manitobans, that's a wonderful thing. No one wants to wait for an exceptionally long period for anything, of course, but we did lead the country under the NDP in wait times, and we are the only province that's made some headway on reducing those at our emergency rooms. So now, with respect to COVID testing, we're able to say we're making progress in reducing those waits. That's important. We're also shortening the time periods, thanks to the work of our senior medical people that are used up between the time that the test comes in and the time that the results go out. I'll be talking to the Prime Minister, if not later this afternoon, then tomorrow, on a number of fronts, but the federal government is also offering to assist us with additional supports in a few categories, and we appreciate that. We appreciate the partnership that they have offered to make with us on some areas of importance, such as data entry and additional measures in respect of the tracking issues that StatsCan personnel can be made available to assist us with. I would just say to the member, his reference to reductions in funding is wrong, it's false, and simply say that we have over $600 million in this year's budget before COVID, additional committed to healthcare investments than the NDP ever made. In terms of other departments, similar increases in education, over $500 million additional was the budgeted amount, and now we've already added to that for Safe Schools well over $100 million in addition. And on families, $200 million in addition, more than the NDP ever invested. So continued reference to false data doesn't give it an element of truth. Continued repeats of false information don't make them correct. The fact of the matter is additional investments have been made, are being made, that far exceed any previous government. That's understandable. Thank you, Mr. Chair, and that's very understandable given the realities of COVID. And so we'll continue to focus on additional investments and most certainly expanded capacity, drive-through sites, testing, tracking, all these areas are critically important, and we will continue to focus on making sure we're doing everything we can to assist to make this horrible time, this stressful time for all Manitobans, a little less stressful as we stay focused on the real battle at hand, which is with COVID.
The Leader of the Official Opposition.
Thanks again, Mr. Chair. You know, I'll let the Premier continue to repeat our message about the cuts to healthcare that he's made, but I do just want to return to the question at hand, which was for him to clarify his comments about what exactly, in terms of expanding testing capacity and contact tracing capacity during the summertime, would have qualified, in his words, as idiocy. Again, I would note that he ran away from his statement there in his answer. He didn't actually address the substantive issue there. And in fact, in a roundabout way, his answer actually kind of served to underline one of the failures in his thought process, specifically the fact that only now, at this point, after COVID, new case counts are through the roof each and every day, is he announcing increases to testing capacity. And I would point out for the members of the committee, as well as you, the Chair, Mr. Chair, that the contact tracing piece has never been adequately explained by this government. They've never actually put a number on how many contact tracers there are working in the province today. So again, expanding contact tracing capacity and testing capacity in November, in late October, that really squandered the advantage that was created by Manitobans making a sacrifice earlier in the year. I think everyone in Manitoba remembers staying indoors for close to 2 months. The reason why everybody did that was to buy this government time. And so I just want to point out for the committee that the Premier actually just said that using that window of opportunity to make the investments in the summertime before the second wave arrived, that he characterized that as idiocy during question period, and now given the opportunity in the estimates committee, has run away from that topic and has chosen not to actually say that he misspoke or to clarify his comments in any substantive way. So again, I would just ask the First Minister, given that he has stated on the record today that he thought that investing in contact tracing capacity and expanding testing capacity this summer was idiocy, Can he now just admit that that was a mistake? Can he just say that that was the wrong thing to say? And in fact, he acknowledges that expanding contact tracing capacity and expanding testing capacity during the summer, when there was a low case count, was actually the right thing to do. Would have been actually the right thing to do.
The Honourable First Minister.
Well, the member can try polishing his own comments and changing mine all he wants, but his question referred to expanding testing at a time when we had no COVID cases for 3 weeks. That's what I'm referring to as idiocy. And referring to my comments erroneously and deliberately here weakens his arguments, and he does that on a regular basis. He referred to expanding testing at a time we didn't need the testing. We instead invested in expanding testing capacity, which he now refers to as something he said, which he did not. Mr. Chair, quite frankly, the member is wrong in his assertions. And he was wrong when he contravened and contradicted the advice of our leading healthcare authorities and told people they should rush out and get tested in the summer, even if they were asymptomatic. This simply would have created longer lines for people who should have got tested, who needed to be tested, who satisfied the criteria that our public health officials said they should before they went for testing. Creating longer lines for testing might be something the member wants to achieve as a political goal, but it's not a goal that any Manitoban would support. What we want to be able to do is make sure that there is testing available, and there is, for those who have symptoms. So October 1st, a new mobile site at 1181 Portage Avenue was opened. October 10th, expanded capacity at 2735 Pembina Highway. October 13th, a new drive-through site at 1066 Nairn Avenue. October 17th, a new site at the Brandon Keystone Centre. October 31st, a new site at 125 King Edward Avenue in Winnipeg. And also additional upcoming test sites will be opened as well. Thank you to the work of our healthcare leaders for the planning and preparatory work they've done to make sure that such sites can now be opened. November 6th at Portage. November 6th also at the University of Manitoba. November 6th as well in Winkler. November 13th at Assiniboia Downs. November 27th in Arborg. So as of today, as we escalate our pandemic response system level to critical level red, at the same time, we know that we have expanded massively the number of available testing sites to reduce the waits for people, which the member would have created longer waits for had he been successful in urging all asymptomatic Manitobans to go and get tested earlier in the year. That would have done nothing. Those same people who would have followed the member's advice, not health expert advice, but his advice, would actually have had to go and get retested as soon as symptoms appeared, and it would have been a fruitless waste of time. That's the bizarre suggestion the member made then, and that's what he's repeating into the record today. He was talking about why we didn't expand testing in the summer. The reason is our testing expansion, our capacity was our focus. And the expansion of capacity is what we did invest in and what we are now seeing bear fruit for the people of Manitoba. Again, the member's not a health expert. He continues to try to position himself as one, but will continue to follow the advice of our leading health experts like Lynette Saragusa and Dr. Brent Roussin and many, many others who work in our WRHAs around the province and elsewhere in our health department and so on. Because it is those people that have assisted us in being able to do things like expand our appointment booking systems. We introduced those to several sites in rural and northern Manitoba. Since October 20th alone, we've had almost 3,000 appointments made by phone. We've had 1,350 made online in Winnipeg, and most Manitobans were able to get same day or next day appointments in less than a minute of calling. These are the kinds of things that are happening, not because of luck, but because of planning. Planning by our health experts that's now seeing real results and better services at a time when we need them.
The Leader of the Official Opposition.
Thank you, Mr. Chair. I just want to thank the First Minister for his candor and for confirming at this committee that he does believe, in a very mistaken way I would add, he does believe that expanding testing capacity this past summer would have been idiocy. So I'll just leave it to him to continue to try and explain to people how that makes sense, you know, to use the sacrifice that all Manitobans made earlier in the pandemic as an opportunity to prepare for the second wave, and not just to shirk the obligation to act, but in fact to characterize one of the laudable goals that public health officials the world over were recommending that people do, jurisdictions should do, which is to expand testing capacity, that he thinks that that was idiocy. I just want to state for the record to you, Mr. Chair, and to everybody else watching, that I think that that is actually wrong, and that I believe that the government should have moved aggressively to expand testing capacity this summer. And of course, that they should have hired contact tracers so that we could have had latent capacity in the system, and that we could have been better prepared for when the second wave did arrive here in Manitoba this fall. Again, one of the concerns that we have with the contact tracing piece is that at this point it seems largely to be an academic exercise. And what I mean by that is that contact tracers are not reaching the close contacts of people confirmed to have COVID-19 quickly enough to prevent them from exposing other people in Manitoba. So while it might help us to understand what happened 10 days ago, 14 days ago, the contact tracing capacity is not actually serving one of its important goals right now, which is to suppress future outbreaks. Unfortunately, we've not just seen that generally, but we've seen that specifically with respect to schools, when we've seen letters arrive home to parents warning of cases that happened, 10 days in the past. And of course, potentially there were exposures happening in the interim. And so that is a very, very serious concern. Now, we have been successful through our research in being able to pin down some of the numbers of people working in contact tracing in the various health regions outside of Winnipeg. I believe Prairie Mountain was the first to respond, and then Interlake Eastman, Interlake Eastern responded basically at the same time. Subsequently, we received some research from Southern Health and from the North, but we've never actually heard from the Winnipeg Health region about how many people they have working for them on contact tracing capacity. I want to be fair. I also want to note that the government has made an announcement about Red Cross assisting in this respect. But I would like the Premier to tell us how many people are working as contact tracers in Winnipeg, including in the Winnipeg region, and including any folks who may be working there by way of the Red Cross.
The Honourable First Minister.
Yeah, just again, the member keeps digging the hole deeper for himself. He urged everyone who was asymptomatic during the outbreak in Westman to go and get tested. He put that on the record, and that's what he's running away from right now. And that was horrible advice, and it would have had the effect of making the wait times for those who had symptoms incredibly long if people had followed it. Thank goodness the vast majority of people did not follow it. It would have been totally useless. That's what I'm referring to when I say, when the member calls for more testing in the summer and misses the point that we were expanding testing capacity in the summer and that we're now reaping the rewards of it. The member was totally misrepresenting my comments and trying to cover up his own. He had positioned himself in the summer and later as a health expert, which he is not, deliberately contradicted the advice of Dr. Roussin and others who were encouraging people who were only those who were symptomatic to pursue testing. He deliberately contradicted that advice, and that is what I call idiocy. I will go on to elaborate for the committee on the new appointment booking process, which I mentioned earlier, because I think that is important to understand that people can now go online to line up their appointments rather than waiting is a very useful additional service, and we're getting a lot of good comments from Manitobans on that. And in particular, it's not just the lineups that they were enduring. As the number of symptomatic people began to grow, it was also the time waiting on a call of various kinds. We now have call waits that are less than a minute for people that are scheduling their appointments, and that's good to know. Thousands of people now using that service. That's also good. But I think the other key benefit now is the new micro credential course that's being offered at Red River. And I thank our former clerk, Fred, for helping us in respect of this, and the folks at Red River, to train healthcare providers on how to safely perform a nasal swab on adults and children. I think that's very, very useful. I think also in terms of the first graduates, they are already qualified and out there, and I understand there's a full enrollment in additional course training at the Red River College, so additional providers can be offered training opportunities. This is going to assist, whether it's in Winnipeg or in other health regions, to take what has been a load, for sure, for our frontline service providers in terms of the testing work that they've had to do, and make sure that we have folks that are available to do that testing. And I should also mention that officials have had been and are continuing to work with Doctors Manitoba to expand the community-based doctor's offices. And this I understand. I'm not a technical health expert. I know that the member for Fort Rouge is not either, though he tries to position himself as one. But I would say from Dr. Roussen's comments that these offices will be very useful for people who have significant other underlying conditions to be able to avail themselves of testing without having to be in a situation that might be more dangerous for them specifically because of those underlying conditions. Some medical centers have already brought testing online as well, and we're going to see more testing available at additional locations available in coming days. I outlined some of that for committee members earlier. It's worth looking back on the response to date, not just with a critical eye to what could have been done differently, but with a thankful eye to what has been done. I know this is missing from the perspective thus far demonstrated by the opposition leader, but
1 minute remaining.
Announcing our participation in the national, thank you, Mr. Chair, early on, acting early on to protect our most vulnerable, whether it be in seniors' homes, announcing our participation in a national procurement for PPE program in the first week of March, Mr. Chair, and then proceeding to also work with Manitoba small businesses to add significant availability through manufacture here in Manitoba of PPE was a very significant early days measure. And we've done hundreds of millions of other investments through our Manitoba Protection Plan to assist homeowners, businesses, enhance health preparation, health preparedness. So thinking about your actions earlier is something that is very important. We've done that on a number of fronts. I'll share many other initiatives with you momentarily, Mr. Chair. What does this say?
The Leader of the Official Opposition.
Thank you, Mr. Chair. Sometimes it's difficult, even for myself, the person asking the question, to remember what the question was when the Premier runs away from them so quickly and so far. Again, the question was about contact tracing and how many people are working as contact tracers in Manitoba right now. Ideally, hopefully, we can flatten the curve, the capacity that we have for contact tracing right now, given that people are waiting for so long, 10 days for schools to hear about potential exposures in some cases, waits over a week just for the average person out there to hear back, even just a call from a contact tracer once they've received a positive test. So again, I think knowing what the resources are there would help the people of Manitoba to better understand what is going on with contact tracing. So again, the question is, can the Premier tell us how many people are working as contact tracers, first in the Winnipeg Health Region, and then province-wide, and inclusive of anybody who might be working via Red Cross? How many people are working as contact tracers in Manitoba right now?
The Honourable First Minister.
Yeah, the member's asking how many people do contact tracing. Literally hundreds. What we've done, what the health experts have done, is they've added to the ranks of those who were engaged in the low demand time as the demand has risen. So they've responded as any common sense person would do. not by beefing up the numbers beyond the need for them to do work, but rather responding as the need to do work rose. And so, for example, through our RHAs and various other health management agencies, we've redeployed 290 nurses who now are engaged in assisting in the contact tracing exercise to beef up tremendously the ranks of those who are doing that important work. We've hired an additional 40 nurses to do that work while redeploying others. That's on top of the 290, so we're talking 330. We've also engaged Red Cross in adding staff, which I understand. 60 staff initially will be added to assist in contact tracing. They'll be engaging in that assist this week as needed. This is a surge capacity opportunity. If as we all, I think, hope that we can bend the curve by getting Manitobans on board with additional adoption of the fundamentals. So if we can do that, then perhaps we don't need the backups of Red Cross. That'd be the hope. But the Red Cross initially offered, and we are going to be paying for 60 additional staff there. Also, StatsCan has made available already 10 staff. I would like to see us have more in abeyance in case the curve continues to worsen. We need to prepare for worse scenarios, and we'll need additional surge capacity. That's one of the topics on my agenda for discussion with the Prime Minister, and has been, I understand, discussed by health officials with federal officials already. But I want to re-message the Prime Minister on the importance of having additional federal staff available where they may be needed. Most certainly, it's not solely in contact tracing, though that is an issue of great importance, but it's also in areas like the data entry part that is necessary, obviously, as we do more testing. And our testing capacity, as I mentioned before, Mr. Chair, has accelerated, as really significantly accelerated as the need has grown, the capacity has grown right along with it. This is evidence of our health leadership doing preparatory work. The member has stated they didn't do enough. He's been critical of our health leadership and contradicted them on several occasions in recent weeks and months. That's disappointing, of course, but that's his choice. But the fact remains that our health officials need our support now most of all. I would say to the member that, when we had low case numbers, he was quiet. He didn't offer suggestions of any significant quality, except that asymptomatic people should go and get tested, which is, bizarre. And the fact of the matter is he was quiet. He wasn't attacking our health officials then. So I'd encourage him now, when case numbers are rising here, as they are throughout the Western world, almost without exception, throughout Asia, without exception, in South America, without exception. As those case numbers rise, don't look to blame public health officials.
1 minute remaining.
That's not fair. It's not right. And so thank you, Mr. Chair. I just say to the member, what a fair weather friend he's turning out to be. Just like the way he treated Greg Selinger after he went to bat for him and got him to be a candidate. He's now threw Greg under the bus. Now he's throwing our public health officials under the bus too. They worked their tail off all summer to get ready. They've developed, I'll share with him the detailed plan, if he would like, in terms of the intensive care beds. It is fascinating how much work they put into getting ready so that we'd be able to have that capacity on the intensive care side. That work is impressive, and I think that those folks, like Dr. Roussin, they deserve us having their back. They don't deserve us putting a knife in it.
The Leader of the Official Opposition.
Yeah, when Dr. Roussin went out there and put up the red light on Friday, and there was a need for leadership to come out and help share the message with Manitobans, I was there. The Premier was not. And so we have been vocal throughout the summer about the need for increasing contact tracing and testing capacity, as well as many, many other preparations for the second wave, such as the Safe Return to School plan. The need to hire more teachers and to rent more classroom space so that kids could actually have a 2-meter space between them while they try to learn. It would appear that the Premier's approach to back to school was, instead of making any investments to help keep children safe, it would be to lean on public health officials to just water down the 2-meter requirement to 1 meter. And again today, you know, it seemed like the Premier had not spoken to Dr. Roussin anytime recently. You know, Premier's out here talking about like measures that should have been implemented weeks ago. He's talking about, you know, maybe if 20-somethings would stop partying, that would help us flatten the curve. Of course, now is not the time for partying. But if you were to listen to Dr. Roussin today, he was putting out a warning about transmission within households. So it seems like, once again, when it comes to listening to the public health experts, that the Premier's late for showing up to the game and still focusing on the wrong message. Similarly, again, Dr. Roussin is talking about outbreaks within hospitals, personal care homes. These are areas where a provincial government, acting quickly, earlier on during the pandemic, securing more protective equipment, more masks, would have made a difference. Over the weekend, including Friday of last week, even earlier than that, we've heard from many, many health professionals, people who work on the front lines, intensive care unit doctors, nurses who work in hospital wards, healthcare aides who work with seniors in personal care homes, those people that we value so dearly. And they've been raising concerns about capacity, but also even things that we thought had been addressed earlier on during the pandemic. I think we all remember that there was a shortage of the N95 masks taking place in March. We had expected, you know, but though we certainly can't take credit for it because everyone was calling for, you know, an increased procurement, an increased access to supplies of masks and other protective equipment. But you fast forward several months later, and here we are, nurses who are working with people who are found to have COVID still don't have access to the necessary masks and the necessary protective equipment. So what was actually happening? What was the government doing with all that lead time that they had to secure protective equipment? We haven't seen the protective equipment make its way to the frontline workers who need it. So what happened? Where along the way did this government fail in its efforts to try and secure masks and other protective gear to help nurses? And what specifically would the Premier say to those people who are dealing with outbreaks on the job as to why he has failed to provide them with a simple mask?
The Honourable First Minister.
Well, there's so much silly stuff in the preamble, it's hard to confine it to my 5-minute limit, Mr. Chair, but I'll try to address one silly thing at a time. The member talks about him showing up for a presser to Showboat on Friday. Congratulations, big deal. That's not what Manitobans want. That's not what they expect. We have Dr. Roussin out there announcing potential measures. That's how we've done it since March. Then the day the measures come in, I and usually the health minister go out and we answer questions about those measures. This is the standard approach we have taken from the get-go. The member references harshly comments designed to hurt. This is his nature. It's his tendency to want to harass and to bully. But the reality is that I and the health minister have been out over 110 times in the last 5 months to the media, answering their questions directly and honestly. And we continue to do that in the interests of getting the information out there, just as I did today, Mr. Chair. The member ridicules my comments about under 40 public gatherings. I would remind him that Dr. Theresa Tam has said that it is one of the greatest dangers for Canadians to gather excessively in large numbers, and in particular, in her own comments, has referenced the under 40 group. This is a reality, and it's a reality we are doing our best to address through messaging, through advertising, some advertising which will be, in addition to the current advertising budgets, pretty extensively invested in preventative focused advertising to get the message out on things like we talked about, physical distancing, washing hands, wearing masks, and so on. But also because those messages have been out there and most Manitobans have listened to those messages, we know that we have to target additional messages, in particular to some of our younger folks, because they are, like all of us, certainly social animals, and they want to be with friends and they want to be out there enjoying their lives, and that is totally understandable. But what isn't acceptable is meeting in larger groups without the benefit of protections and masks. And doing that jeopardizes not only the young person themselves, but as we all understand, and I hope the member would understand, these are significant problems in terms of the danger of transmission. And so today we added on to the advice previously given by health experts like Dr. Theresa Tam, like Dr. Brent Roussin, and emphasized the message that many of the new cases, many, not all, but many, are linked to people ignoring public health advice and attending larger gatherings, leaving their homes even though they have symptoms. Dr. Roussin shared some of those examples last week. Some cases have been linked to Thanksgiving, other gatherings where people are often sharing items. He talked about even in some groups sharing vape pens, for heaven's sakes. Got to know better than that. I'm sure the member knows better than that. In one example, 7 cases were linked to the same Thanksgiving dinner. Other cases have been linked to people traveling. So our emphasis now is to ask Manitobans to reduce their contacts for this month of November. I would hope the member would echo those messages. If we can reduce our contacts, that will help. And, again, the member can criticize my messaging or capability, can't criticize accurately the frequency of my attempts to get these messages out there.
1 minute.
And the reality is, here's a quote from somebody that we should, thanks, Mr. Chair. Here's a quote from somebody I think that we should trust and respect that says, and so we can see how our close contacts can quickly become cases and more contacts. That's Dr. Roussin. And he has said that many, many times, as recently as in my last discussion with him this morning. The member has been critical unjustifiably of Dr. Roussin. He has recommended advice that contradicts Dr. Roussin. This is not helpful. And I encourage the member to understand these health experts are experts, and they deserve to have our support, especially now in challenging times. Stay with Team Manitoba is what I would encourage him to do. Get with Dr. Roussin, Lynette Siragusa, and our healthcare leaders, and offer them your support and encouragement, not your criticisms.
The Leader of the Official Opposition.
I shared a very strong message in support of Dr. Roussin's public health orders as well as his advice. If the Premier had shown up on Friday, if he'd been at work on Friday instead of taking a long weekend during Manitoba's darkest hour, he would know that. I suspect he actually does know that, and that's why he sent his staff out over the weekend to count up all the media appearances that he did, instead of course, doing something that would have helped fight the pandemic. But such is the nature of the damage control that you have to do when things get away from you. In this instance, the question was about masks. We know that there are people who could be delivering life-saving medical treatment who are not able to serve at the bedside right now as hospitals reach capacity. In fact, overcapacity, if you factor in the slack that's necessary to deal with events like car accidents. We know that there's a lot of people who could be delivering life-saving care who are not able to, either because they've acquired COVID-19 in the workplace, a hospital like Victoria General, a hospital like St. Boniface, other sites, personal care homes. And there are still others who are unable to work because they were potentially exposed and they have to self-isolate and monitor for symptoms, etc. It seems like some of the very fundamental things that were ignored by the government in this instance that contributed to a large number of these healthcare heroes being unable to work is the fact that they didn't have access to simple things like a mask. Earlier on during the pandemic, everyone said we needed to secure more masks. Everyone said we needed to secure more protective equipment. And so, of course, we were part of that chorus, but we were no different or not special in any way, because every single public voice was saying that we should secure more masks and protective equipment. But what I'm curious again is what happened between then and now? What happened between a unanimous consensus amongst everybody, including in our province, that the top priority, one of the top priorities for the healthcare system should be to secure enough protective equipment to protect our frontline workers so that they're not taken out of the workforce due to exposure or acquisition of COVID-19. What happened between that and the current situation where nurses, healthcare aides, other healthcare professionals tell us that they have inadequate access to masks and to protective equipment still? We have letters that are signed by physicians. We have statements that are made by nurses. And we know that that is just the tip of the iceberg, because there's many other people who fear, for their health, but maybe for whatever reason, they don't necessarily want to speak out publicly about it. So I just want to know, why is it that a nurse still can't access an N95 as needed in Manitoba? Why are they still facing shortages of protective gear? What happened to the procurement process that there still is this, question hanging over the delivery of health care as we deal with a surge in new COVID cases? Again, this is something that the earlier sacrifice, earlier this year, made by Manitobans, that sacrifice should have bought this government time to procure masks, gowns, gloves. Again, we were one voice among many, but the question remains, what happened? Why is there still a shortage for the nurses working at the bedside, for the healthcare aide working out there? And what happened remaining? What happened with this government's procurement process that we're still dealing with this, this rationing of N95 masks as the hospitals are hitting capacity?
The Honourable First Minister.
Yeah, thanks, Mr. Chair. Well, I'll tell the member who is, I think put himself in the position of being vulnerable to the charge that he is trying to showboat. I'll tell him that he needs to understand that the work that's been put in by this government and our senior health officials is demonstrable in the face of an unprecedented pandemic and not worthy of his disdain. I would also say to him that what he is doing now is needlessly fear-mongering when that is not justifiable or fair. I can tell him that the actions of our government in terms of COVID response for personal protective equipment have been singularly effective in getting the enhanced sourcing that we needed for PPE for Manitobans, including medical masks, gloves, gowns, face shields, critical equipment, testing kits, ventilators, and other supplies necessary to make sure that we were protecting not only our frontline personnel, but that these materials were available for others who might wish to have them in their workplaces as well. I can tell the member that we set aside $400 million, of which more than 3/4 has already been allocated to date for PPE. I can also tell him that close to half those orders were satisfied by vendors in Manitoba, including many Manitoba companies that answered the call when we ambitiously asked Manitoba small businesses if they would participate in supplying us with materials that were not to the degree that we would like made available from Ottawa, who assured us early they'd handle all of this and did not, quite frankly, do what we needed them to do in terms of making this available. Our purchasers have engaged in massive procurement operations, purchasing tens of millions of dollars of PPE and other necessary products and services. Whereas other jurisdictions, I won't get into all the horror stories, but other jurisdictions across Canada, around the world, experience genuine shortages of PPE. Such has not been the case in Manitoba. The members should be congratulating the people who work so hard, both in the private sector and in the public sector, to address this issue early. We have a live activity tracker on COVID alternative supplies, equipment, and services status that was set up to keep track of the dynamic procurement activities. And I can tell the member what he is putting on the record today about shortages is simply false. The services on that tracker include issues like home nutrition and learning, web-based crisis line, air service. I could get into the mental health programs, the seniors programs, the programs for the disabled that we've pioneered here in Manitoba that no other province was using. But we've taken initiative and we've moved it into the COVID response where the member is critical. He is using fear-mongering as a technique, which is not justifiable or supported by the facts. PPE, including gloves, face shields, eye protection, gowns, disposable isolation gowns, disposable surgical gowns, reusable gowns, scrubs, masks, body shields, powered air purifier respirators, as well as the manufacturing and the sterilization of these products, also important, has all been managed by our government departments in partnership, as I said, with suppliers in the private sector. And I'll share for the member because I think it's important for all members of the committee to know the degree to which Manitoba small businesses, Manitoba vendors have stepped up and assisted us in making PPE available. This partnership is, thanks, Mr. Chair. This partnership is one that we deserve, all of us deserve to be very, very proud of. And, you know, I can tell you that literally tens of millions of dollars of contracts to Manitoba companies have been signed to assist us, whether it's Barrick Medical, Blue Oasis, Canadian Gold Beverages, I better get that right, Central Dental Solutions, Cerebra Medical Limited, and I'll keep reading the list for the member because when he criticizes our program, he's criticizing the businesses that have partnered with the government to make PPE available, and I don't think that's justifiable.
The Leader of the Official Opposition. The First Minister said there were horror stories in other jurisdictions in his previous answer. But I just want to read the headline above the fold from today's Winnipeg Free Press. This is Monday, November 2nd, 2020. Horror story after horror story. Nurses detail lapses at Victoria Hospital. And just for the purposes of clarity for the committee, horror story after horror story is not the characterization of the editorial staff at the Free Press. That is a direct quote taken from the article. And so again, the businesses that supply the protective equipment, good job. Where I think the failure occurred was within the government. Somehow the government has spent $300 million, or I should clarify, the government has allocated $300 million for protective equipment, according to the Premier's previous answer. And yet, even though they have allocated so much money, we are still hearing about nurses who don't get a mask when they ask for one. We're hearing about other nurses who get one N95 mask a day and a brown paper bag to store it in while they eat their lunches. This is a rich country that we live in. This is an advanced economy. A nurse should be able to access the protective equipment that they need, anytime they need it, to care for somebody at the bedside. If a nurse is being provided with one mask per day, and they have to store it in a brown paper bag while they eat lunch, it suggests that the public health guidance that they should discard protective equipment like a mask when it gets soiled is not being observed right now. So I have the utmost respect for the manufacturers who create the protective equipment. I have the utmost respect for the healthcare heroes who wear the protective equipment in order to save lives, in order to make lives better. But it seems to me that between those two ends of the procurement process, there must be some problem within government. I suspect that the problem is that the $300 million has been allocated but not spent by this current government. The Premier is free to confirm that in his answer, if he likes. But whether or not he confirms the fact that his underspending habit is continuing with respect to protective equipment during the COVID-19 pandemic, I would like him to grapple with the question and to provide an answer for the committee as to what happened along the way so that the protective equipment that the government has announced and issued press releases over has not actually made it to the bedside where it's needed by nurses and other people who work in healthcare. Is it that the protective equipment was never purchased? Is it that the protective equipment doesn't actually exist? It only exists in the form of announcements and press releases? Is it there's some stockpile sitting somewhere under lock and key that nurses and other people in the healthcare profession don't have access to? These are the questions that Manitobans are left asking today. So what is it? How does the First Minister explain that notwithstanding any of the announcements he's made around procurement, that nurses are still forced to reuse, are still forced to go without, and are still forced to contend with shortages when it comes to masks?
The Honourable First Minister.
Well, now we understand why the member was nowhere to be seen for the first 6 months of COVID. When we were doing well, he was letting the Free Press do his research for him, evidently, Mr. Chair. If he's going to cite issues, I'd encourage him to cite facts that support the position, not just rumor. And I'd encourage him to do the necessary work to prepare his arguments a little better than just simply reading something from a report in a newspaper that may or may not have been well researched. It's unsurprising that the member would choose to resort to this level of disconcerting neglect in respect of the people who've worked so hard to make PPE available in our province for so long. But it comes as no surprise to me. I've coached a lot. I've worked with a lot of teams over the years, and I've seen people be very quiet and supportive of the coaches and managers of teams when they were winning, and suddenly become, rebellious, like the former NDP caucus was of Greg Selinger, rebellious when times get more stressful. I see this member demonstrating that tendency today in his comments, that attitude of disdain for people who he should be showing respect for, in particular at a time of great stress for Manitobans and for the people who are giving us the advice and working so hard. For example, those people in our civil service who work so hard to get the PPE. Think about them for a second while you're making these disparaging comments. Think about the people who work in our private sector companies, like some of whom change the operations of their businesses to accommodate our needs for PPE. Cerebra Medical, I think I might have mentioned, Diesel Custom Sewing, Eli Promotions, EQ3, Executive Sports Apparel, Farmery Estate Brewing Company, Fried and Fried International, Grand Medicine Health Services, Icon Technologies Limited, Interpoc Incorporated. And I'm listing right here now are Manitoba companies with Manitoba employees that have invested in Manitoba and have focused themselves on getting PPE and relevant protective equipment in various categories to be available to Manitobans at a time when, we got some of our support from the federal government late, but there were many, many early days when these Manitoba companies were the ones who stood up our supply. And I've shared with the member, and he I guess didn't remember this or just didn't retain it, but over $150 million. Okay, almost half of our purchase orders have gone to vendors in Manitoba. And I say to them, thank you. Thank you to you Thank you to your staff. Thank you to your teams for the great work you've done for Manitobans. Mammoth Equipment, Metagas, Meditech, MEP Brothers, Menace Creek Brewing Company, Mondetta, MWG Apparel Corp., North Country Outdoor Furnace, Northern Diagnostics, Oil Mart, Orient Works, Pacific Development Manitoba Limited, Peerless Garments, more than $1 million contract there. Pine Falls Clothing, great production there. Polymer Shapes, distribution. Portage Medical, Precision ADM, Protective Textiles International, and there's many more, Madam Speaker, or Mr. Chair, I'm sorry. And, I know the member may not want to hear this, but we are very thankful of the work these companies have done. We're tremendously appreciative of the work that government employees did in organizing the procurement and coordinating the procurement of these made in Manitoba products. And we believe very frankly that what the member is doing right now is belittling that contribution, and that is not justifiable. We have more than a year's supply of PPE available right now, and we have 2.5 million N95 masks coming to Manitoba in the next little while. Thanks, Mr. Chair. And that's going to give us an opportunity, because we have a demand that's clearly got to be met of about $100,000 masks, I'm sorry, Mr. Chair, per week. So that clearly gives us that opportunity to know that for at least half a year, we've got the N95 issue dealt with. The member may recall that early on in the pandemic, this was a big fear for a lot of people that there wouldn't be N95 masks. And the fact of the matter is, now we know we've got a half a year just on that category alone. Most of our other PPE, we've got stockpiles now accumulated thanks to the work of mostly Manitoba companies that are going to be able to give people protections. He's fomenting fear. This is not right. This is not a thing to do right now or ever, frankly, but it is, especially based on false information. But it's certainly not in the middle of a pandemic, a wise move to start going after the fear factor and trying to scare frontline people unnecessarily. And that's exactly what he's doing. Thank you.
The Leader of the Official Opposition.
Oh, sorry. Yeah, no, I appreciate your interjection there. I think one of the things that Manitobans have been talking about for months now is just the off-key approach of the Premier's billboard campaign during the summer. I think the reason that it's attracted so much attention, negative attention, to be specific, is that it seemed to be putting up that mission accomplished banner, just like George W. Bush did before the war in Iraq was over. You know, the Premier seemed to be saying that, things were great and that the pandemic was over and now it was hashtag restart time. When in fact, that attitude seems to have been indicative of an attitude of complacency within the Premier's office. Now that we are in the midst of this string of high case counts and physicians are warning that hospitals are over capacity and that even with surge capacity measures that there will be strain for the weeks to come. Does the Premier now admit that his summer advertising campaign and his Ready, Safe, Grow billboards were a mistake?
The Honourable First Minister.
Hey, I'm ready. Premier John Horgan of British Columbia is not a noted progressive conservative, but he has repeatedly communicated the vital symbiotic relationship between progress in rebuilding our economy and the successful battling against COVID. These two things are not separate. This is the fundamental confusion the member seems to have. He seems to think that if everybody's unemployed and we have no COVID, that the country's going to be a stronger country or that Manitoba is going to be a better place. He's wrong. There's no data to support this thesis, none. The fact of the matter is, Ready, Safe, Grow has focused over 60% of its time and effort directly on healthcare messaging to make sure that people get the message that we have to be safe in order to grow. Fundamental to the message, Ready, Safe, then Grow. This has been a three-pillar focused messaging campaign from the get-go. From within a few days of the launch, we were focusing with Dr. Roussin on messaging to people about washing their hands, These are the kinds of messages we were delivering to the people of Manitoba when we had no cases. We were focused. We were focused on getting the message out and repeating it, that the fundamentals are what's going to keep you safe, that we can't grow without safety. That's implicit in the message. The members repeating criticisms that have no bearing on the reality of the situation. You know, frankly, we have led the country in getting people back to work, and that is good because Manitobans want to work. But if the member is suggesting that we shouldn't be promoting work and programs to help small businesses on one hand, and on the other hand saying we haven't done enough for small businesses, he's caught in a little bit of a contradiction there. The fact of the matter is we have some of the most generous programs to support small businesses in the country of Canada. And we promoted availability of those programs to help people get their lives back and get their jobs back. And good for us for doing it. And thank you to the small businesses that took advantage of those programs. We're talking about 10,000 small businesses in this province that have already received the GAP program funding. That's 95% approval within 2 days. Whereas other provinces haven't done anything like that. We have that program, and some people ridicule and say it's small. Well, a lot of our businesses are small too. And I come from a background unlike the member, where we had spoons, but they weren't silver. And I can tell the member that the fact of the matter is when you had $6,000 available to you in a difficult time, that was a really, really good thing. And I'm going to get some comments from hundreds of Manitoba businesses, and I'm going to read them to the member, and then he can understand that his little diatribe is falling on deaf ears out there. When he talks about us not doing anything, there's 10,000 Manitoba businesses out there right now that are very thankful that we have a program that supported them. And there are also over 20,000 Manitobans that have been able to get back to work because of our job subsidy programs that are partnering with small businesses, partnering with nonprofits, partnering with charitable organizations, partnering with our business community, something the NDP was never very good at. They saw our small business community as a cow to be milked. And the reality is they did that. They raised the tax rates for small business. They jacked up the fees and charges. What have we done? We've lowered the fees. We've lowered the charges. We've reduced the costs for small businesses. For example, for things like the workers' compensation premiums, for things like the insuring for the PST on your insurance on properties. We've taken that off. These are tens of millions of dollars, and I could go on. I mean, we have many other programs like the MPI rebates that have allowed hundreds of millions of dollars to be available to Manitoba small businesses that wouldn't have been available without our actions. So I get a little adamant on this one,
1 minute
Mr.
remaining.
Chair, because the member is so out of touch with the reality of Ready, Safe, Grow. Ready, Safe, Grow. The member is suggesting we shouldn't have advertised programs that helped over 20,000 people get their jobs back. That's just wrong. The member is suggesting that somehow we couldn't have at the same time advertised for safety and safe practices. We did. We advertised for both because, as Premier Horgan has said, a noted NDP leader in our country, the only NDP premier, the symbiotic relationship between a stronger economy and stronger healthcare is indisputable. And I agree with Premier Horgan. I would ask the member to maybe consider giving Premier Horgan a call, getting a briefing. Don't just read the Free Press for research. Talk to real people in positions of real leadership, and you may find that you'll learn something.
The Leader of the Official Opposition. Just want to remind the Premier that I'm on the other side of the legislative building watching him by video, so it's not necessary to yell at his computer screen. I can hear him just fine. This whole Ready, Set, Go campaign that he's got going on, you know, I think it does typify the mistakes that he's been making with respect to managing the pandemic. And when it comes to speaking to real people, I can tell him that I've spoken to a number of real business owners, specifically the owners of some of the 15 small businesses that were closed at the Premier's orders for the past 2 weeks. Now, I don't think many of us were surprised that closing the King's Head and closing Club 200 and closing the Pyramid Cabaret didn't actually flatten the curve. But what it has actually produced is a tip of the spear, a warning of what is to come for other small businesses if the Premier continues down this path of mismanaging the pandemic. These businesses are warning us that they are teetering on the edge. You know, I'd like to think positive, so I don't want to say what the edge is there, but I think we understand how serious it is for many of these small businesses. They also understand the importance of managing the public health measures in the pandemic. But I think what would make it easier for these business owners to be able to abide by the restrictions or the closures or the capacity limits that they may face is expanded financial assistance, direct financial assistance. We have seen that there were loan programs, we have seen that there were deferrals, but the deferrals are now coming due. The invoices from suppliers are past due. The businesses can't take on additional debt. There is a need for quick and easy access to cash. When we bring these ideas forward, we're not bringing them strictly because it's something that we believe in. We're bringing it because we want to amplify the voices of the people of Manitoba. What the people of Manitoba are saying loud and clear is that small businesses, local businesses, are going to need help from this government, new help, to survive this new Code Red period. When it comes to the Premier's Ready, Set, Go campaign, while he was at the starting line saying we should be first to reopen, he took off sprinting, and the destination that he ended up running to was a situation where Manitoba is instead #1 in the country for new COVID cases, where instead Manitoba is #1 in the country, perhaps even #1 in North America for test positivity rates, depending on the day. And so it seems that the Premier's rush to reopen actually had a very damaging effect on many businesses. And, you know, I'd suggest to him that an approach that would have focused more on public health, that would have focused more on the need for continued vigilance against COVID-19, rather than putting up billboards that would have to be taken down within a few days of their launch in the summertime, that would have been the better approach. And while I don't want to suggest that we could have avoided the second wave, perhaps we could have managed things a little bit differently. Perhaps a tone that didn't start with Ready, Set, Go, which suggests everybody rush to the beach, would have been better served here in Manitoba had it been replaced with a campaign that says, yeah, we're going to reopen, but this thing is going to be with us for a long time. And so we all need to take seriously and not let our guard down, that while we have some fun this summer and get to return to a little bit of normal, that this thing is going to be waiting for us in the fall. It's going to be waiting for us in the winter.
1 minute
and we're going to have
remaining.
to get back to the basics when that happens. So again, after having laid that out, I just wonder, will the Premier now admit that that Ready, Set, Go campaign was a mistake?
The Honourable First Minister.
What I'll admit is that what the members just put on display here is his own inexperience. He can't even get 3 words right. Ready, safe, grow, where 60% of our emphasis was on the safety of our businesses and our workers. And we also promoted the readiness of our programs to support the small businesses he claims now he wants to support. What he also put on display with his comments, Mr. Chair, was that he doesn't want to respect Dr. Roussin. Dr. Roussin is the one who put the rules in place for the King's Head Pub. Whether the member likes it or not, those are Dr. Roussin's decisions, and we support him in that. The member contradicts himself. He suggests we rush to open up businesses. We promoted partnerships with small businesses who themselves wanted to employ people and help them do that with our wage subsidy programs. The only province in the country that has such programs. The member is contradicting himself. He says that we rushed to open up businesses, and now he wants to contradict Dr. Roussin and open up some pubs and bars. We'd like to see every pub and bar open too if it was safe, but safe is the middle word, not set. And the member needs to know that. And he needs to take a look at the advertising we did, the promotional work we invested in, and realize that it was balanced to achieve the goals of people like Premier John Horgan, an NDP Premier in British Columbia, to support our small businesses to help them get people their lives back. I know the member doesn't come from a small business background. He may not understand this, but I most certainly do, and many of the members of my caucus do. Our small business people needed supports, and they continue to need supports. And that's why we've designed our programs to give them supports, the supports they need when they need them. We've expanded our wage subsidy program now, not once, but twice. And we may well expand it again. And what it is doing is helping people to get their lives back. It's helping small businesses to address the cash flow demands they have by paying 50% of the salaries of employees, up to 20 employees, up to $100,000 available to small businesses. And the qualifications are not hard to satisfy. The approval rating happens quickly. The feedback that we're getting from small businesses is incredibly supportive. The member needs to understand that and perhaps broaden his comments, search out a little more beyond the Free Press and the King's Head Pub. Here's one comment. It was too good to be true. Simple to sign up, a big help, $6,000 for our business, helped to cover a lot of our missed business that we had over the first few months. And it saved us from having to consider selling our business. It's a company called Aim for Life Incorporated. Thank you for your positive comments. They're nice to hear. There are, frankly, dozens of other positive comments here, Mr. Chair. I won't read them all on the record. I just want the member to know that when 10,000 businesses have achieved a support program, they like that. And we like it too, because we understand that small business is important and vital to our economy. And we understand enough about that to take the time to actually promote the programs that have helped all these people get their lives back. Now I have over 22,000 Manitobans working because we partnered with small businesses to assist them with these programs, with a 50% wage subsidy, up to $5,000 per person, with a $6,000 GAP program. And by working with our other levels of government and our provincial partners to make sure that we didn't duplicate or create more red tape, businesses don't like that, that we made sure our programs were designed to complement the federal programs. We fought for and achieved, Premier Horgan and myself, something I know the NDP leader supports, which is paid sick leave for workers. But advocating it from his side of the house occasionally over the summer when he's on vacation and there are cobwebs on his office door didn't really get it done. What got it done
1 minute
was the
remaining.
unanimity of premiers, fought for, negotiated. Thank you, Mr. Chair. Negotiated, pursued diligently by myself and Premier Horgan. Now we have paid sick leave for our people all across the country, run by the federal government. We thank them for that. The Liberal leader says we want credit for it. No, we're happy to give the federal government the credit for doing this. We're also happy to say quite legitimately, we were fought for this long before the NDP had a word to say on it.